My name is Katie Smith, and welcome to Seniors Today, a monthly program for those 50 plus in Montgomery County, produced by the Commission on Aging, of which I'm a community member. Today, we'll learn more about the impact COVID-19 is having on the senior population and hear updates from our local health experts about where we stand locally in the midst of this pandemic and the county's robust public health efforts. Joining me is Dr. James Bridgers. Dr. Bridgers is the Montgomery County Deputy Health Officer. Welcome, Dr. Bridgers.
Good afternoon, Ms. Smith. How are you today?
I'm doing well, and yourself?
Very well. Thank you for inviting me to your senior show today. Always glad to talk about public health in the interest of our seasoned seniors. And it's April Fool's, so I'm going to leave you with this no joke. No fooling, I should say.
Well, let's jump right in. Can you provide us with a coronavirus update about the latest numbers of cases in the county and the projections as far as when a surge may occur in the county?
So great question, Ms. Smith. So the data is indicating that on today, April the 1st, we've seen this past year 66,831 cases with unfortunately 1,430 deaths. And as of today, we had 129 cases. And so we continue to monitor the number of cases on a daily basis, on a monthly basis, and on a weekly basis to identify those areas of needs in which we need to prioritize. So looking at those cases and how we respond to the COVID pandemic, I should say, and opening, we look at all these indicators to determine if in fact we need to roll back some of the provisions or being able to increase some of the provisions. And for the last 2 to 3 weeks, we've seen a slight uptick in the test positivity rate. Now, the test positivity rate for today, April 1st, was 3.22. And what that means is that about 3.2% of the cases of the tests that we have to date test positive. So that tells us that 2 weeks ago, it was 1.92. And that means that the transmission is increasing in the community. So we still need to be mindful and vigilant that the virus is still spreading. It's spreading at a rate where we need to monitor. A moderate to low transmission rate, according to the World Health Organization and the Centers for Disease and Prevention and Control, is about 5%. And if we're talking around 3%, it's a moderate to low rate. And as we see those indicators go up, we need to take a step back and assess where we are with our resolutions, our provisions, our opening, and our closing to make an assessment to see if something needs to be rolled back.
Wow, that's interesting. Thank you so much for providing us, with a sense of the landscape right now, especially from your expertise. And you're one of our trusted healthcare officials. Dr. Bridgers, County Executive Mark Elridge, he recently announced that Montgomery County will be hosting a mass vaccination site. Can you share a little bit more about it in terms of the timing and location?
Sure, great, Ms. Smith. Yet another great question. And Dr. Gales and I just visited the mass vax site this morning. It's located on the Montgomery County campus in Germantown. And we're able to vaccinate 2,000 to 3,000 countyans a day with the goal to vaccinate 21,000 folks a week. This vax site, this mass vax site, is in partnership with the state of Maryland, the Montgomery College, the Montgomery County Police Department, our Emergency Management and Homeland Security, and Holy Cross. So it's a partnership to provide a higher throughput and capability to vaccinate in an area where we've seen higher case counts. And so we've looked at an equity index to identify vaccination spaces in the county. And the Montgomery County Mass Vax site is one of those locations where we identify as a platform where we could get more shots in folks' arms. Now, the Mass Vax site will be fully functional, we anticipate, on April the 8th. we are actually vaccinating at that space. Now it began yesterday, and we're vaccinating the current plan is to operate 6 days a week between 9 a.m. to 3:45 p.m. with the goal, as we increase and receive doses from the state will provide the amount, the increase in doses for this particular vaccination site. 7 days a week to accommodate those individuals, those seniors and individuals who are still in the workforce and may not be able to attend or get vaccinated once they receive the registration link, either from us or the state. Again, it's a partnership with the state to provide more shots in arms in the county. And so through this vehicle, we anticipate that we will be able to operate 7 days a week, including the weekend, from 9 to 7 o'clock to accommodate those individuals who are unable, for whatever personal or professional reasons, to get vaccinated at one of our previous sites during those specified timeframes.
Wow, that's great. I know you mentioned, you have an equity component, and with so many people of different backgrounds living in Montgomery County, I know that they'll appreciate that. In the little bit of time that we have left, I want to ask you just a two-part question. The first
Sure.
is, you told Montgomery County Council, some of those members at a briefing, that your own father tested positive for COVID. So what about testing? I want to know if that's still a part of your improvement strategy, and how to mitigate the virus impact in the county. And then briefly tell us, as we wrap, how can people stay in touch with you as well as our local health department?
Sure, Ms. Smith. Yet a third great question, although the last question part is two parts. So let me answer the first part. So yes, my father did test positive, and more recently, my sister tested positive, and she's 50 years old, and she tested positive earlier this month. All that to say is that there are variant strands in the community. We have the B117, which is the UK. We have the B1351, which is the South African. We have the P1, which is the Brazilian. And then we've recently been informed that we have variant strands from California and New York. All that to say is that if you feel sick, if you've been around folks who may have been exposed and you're unsure, please get tested. We have testing available. We have testing available 7 days a week in collaboration with our Minority Health Initiative, who've been very instrumental in supporting our testing effort. Testing has dropped, and we don't know whether or not it's due to COVID fatigue or folks are more focused on getting vaccinated, but we still need you to get tested if you are in the community significantly or you've been around folks. And so we still ask and encourage you to get testing. We are pushing more for testing to mitigate the risk and suppress any community transmission. The first question was, about testing and where we are with the cases and the test positivity rate. One of the measures or the approaches to decreasing the community transmission is to test folks, to get folks tested, to know their status, and to have them isolate for 2 weeks or until they feel better based on the CDC guidelines. What can we do? We still need to be vigilant. Dr. Walensky indicated on Monday that we still have a ways to go. So we still need to do those, employ those public health measures. We need to wash our hands for 20 seconds. We need to minimize our physical and social distancing. We know that folks are getting vaccinated, but only 30% of the population in Montgomery County has been vaccinated. And as we get more folks vaccinated, folks become more comfortable, we can interact, we can have folks in our personal space, and we still should take those safeguards and those measures in place. Wear a mask. If you are in public and you are in crowded spaces, you should wear a double mask. A cloth mask and a surgical mask is preferred based on the CDC guidelines. Make sure that it's tight fitting so that no air comes in or goes out. And we still need to be mindful of crowds. We still need to be vigilant and standing in those open air spaces where we have better ventilation. We want to see each other. We're social creatures. We want to interact. If you're living in independent living spaces or those spaces where there are more folks, it's okay to wear a mask or encourage others to wear a mask as we continue to test more and vaccinate more. There is light on the end of the tunnel. So all public health officials, from Dr. Fauci to Dr. Gales to myself, are encouraging folks to remain vigilant, to be guarded, to remain safe. And then one day, after all this is over, we can reflect on all those safeguards and those public health measures that we put in place to protect ourselves, and not only ourselves, but our loved ones.
I like it. Vigilance, guidance, and being safe. Well, Dr. Bridgers, what a wonderful conversation we've had. And thank you so much for your service and commitment to our seniors and our families and for keeping us safe. We appreciate you sharing updates on such a relevant topic and look forward to having you back. It's a pleasure to talk with you.
Thank you, Ms. Smith, for having me. Please, by all means, stay safe. And folks, if you haven't pre-registered, please pre-register at the county's COVID information portal. We have information about testing. We have information about vaccinations, those sites. Pre-register, again, going back to the mass vac site, the state will have a registration list for those who have pre-registered for Montgomery County, as well as Montgomery County will have a pre-registered list. So please pre-register, so that you can get vaccinated and again, protect yourself and your loved ones.
We'll make sure to provide that link. Thank you so much.
Thank you so much, Ms. Smith. Have a great afternoon and all stay safe and be well.
Stay tuned. Next, we'll have a conversation with Dr. Patrice McGhee.
You are loved. You are valued. You are resilient. You got this.
You are there for them. We're here for you. Find free care guides at aarp.org/caregiving.
Please join the Montgomery County Commission on Aging's public forum on Tuesday, May 18th at 10 a.m. for an interactive discussion on countering social isolation and loneliness of older adults. Keynote speaker, Dr. Liz Necka of the NIH National Institute on Aging and other subject matter experts will share best practices, innovations, and public policy solutions. Until then, please stay safe.
The Area Agency on Aging in Montgomery County provides a variety of home and community-based services and provides staff support to the Commission on Aging to respond to the needs of adults ages 60 and older in every local community. Joining me is Dr. Patrice McGhee. Welcome, Dr. McGhee.
Thank you for having me.
So excited. You are the new director of the Montgomery County Department of Health and Human Services Area Agency on Aging. Congratulations, and thank you for taking the time to speak with me. If you wouldn't mind, just tell us a little bit about the county's Area Agency on Aging, the work you do, and your professional background.
Well, first of all, thank you, Katie, so much again for having me on the show today. I'll jump right in. The Area Agency on Aging, or the AAA, as we like to call it, serves as a clearinghouse for federal, state, and local funds that are earmarked for older adult services. We are part of a national network and infrastructure of services that are geared for older adults and their caregivers. Our goal is to help seniors age in place, stay in the community as long as possible. We accomplish that goal through resource dissemination and administering programs and services that are aimed at enabling seniors to stay safe in the community, promote their independence, and help them with whatever needs they may have. So Montgomery County has a great approach to aging. They have a very robust network of advocates, community supporters, and individuals who are focused on ensuring an equitable and accessible access to services for seniors. So we have a AAA staff that is dedicated to Montgomery County, is passionate about Montgomery County, and they are constantly seeking innovative solutions to address the ever-changing needs of Montgomery County seniors. I think you asked me a little bit about my background, so I'll be real brief on that. I have a vast background in social services. I hail from Louisville, Kentucky, where I have worked in behavioral health, Medicaid, transportation, housing, early childhood. And most notably, I served 8 years in the largest area agency on aging in Louisville, Kentucky. So that is where I really grew my passion for aging. And I affectionately call aging my first love, my first career love. So that's just a little bit about my background.
Wow, that's so awesome. And it seems like you've also have a background in all the social determinants of health. But I want to ask you briefly, County Executive Mark Elridge, he recently released his proposed budget. How does that budget affect older adults?
So first of all, I want to thank County Executive Mark Elridge for the proposal. It is a very generous investment that is undoubtedly going to expand needed services for seniors in this community. The nearly $40 million budget is going to help us expand program capacity. It's going to allow us to hire health and human services staff. It's going to expand transportation, housing services, as well as senior programming that's going to be expanded through grant expansions. So many, many thanks to the generous proposal laid out by County Executive Elridge.
So good to hear. And it looks like you and both our county executive have a lot of passions that align. And now I can see why you're our new director. So our previous guest, Dr. Bridgers, he spoke to us about the county's COVID response. Now, how has the AAA been interacting with older adults during the pandemic?
So Katie, all of us had to, reimagine service delivery as a result of the COVID-19 pandemic. So one of the things that the AAA quickly pivoted toward was, the senior centers closed. So we worked in partnership with our partners at the rec department, to change our model from senior center congregate meals to increasing our home delivered meals. And we could not have accomplished this without our partners. In addition, we pivoted to virtual platforming. So one of which I want to highlight now is a virtual platform that was launched at the beginning of the pandemic by our very own Lily Fisher, who is our National Caregiver Program Manager. She launched a YouTube channel called Engage at Home. So Engage at Home is a place where we can disseminate timely information to help seniors be engaged, as well as curb social isolation. To date, we have nearly 120,000 views, and it's a platform that we plan to continue well beyond the pandemic.
That's great. That's great. So we only have a little bit of time left, but briefly, if you can tell us how we can stay in contact with you as well as the AAA.
Absolutely. So 3 ways, I'll outline 3 ways. The first one is the county website. So if you go to the county website, click on HHS services, in the top right corner, you will find older adult services. Click on that and it'll give you information about the AAA. Second way, Engage at Home. If you pull up the YouTube platform and plug in Engage at Home in the search engine, you'll be able to see all of the video feeds that are posted there. And then the third way is through our Aging and Disability Resource Unit, the ADRU. So you can call this line and they will provide as much information as you need about all of our programs and services, or anything that's going on with the AAA that you wanted more information about. That number is 240-777-3000.
Dr. McGhee, you're amazing. We look forward to speaking with you again real soon. Congratulations on becoming our new director. I know your commitment and leadership is valued. I value it, seniors value it, and we're so excited to have you.
Thank you so much, Katie. You have a great day.
You too. Coming up next is Mrs. Barbara Selter, Chair of the Commission on Aging.
I first saw Turtle, my heart was full. Now anything but lonely.
We had this deep connection, this heart connection.
He just wants to be close to you and part of your life.
Every day with Turtle is a perfect day.
When I'm holding her, it makes me feel calmer.
I think everything he does shows how much he loves us.
When we adopt a shelter pet,
We discover
they're a little bit of a lot of things.
But they're all pure love.
The Commission on Aging, or COA, was authorized by the Older Americans Act and was established by Montgomery County in 1974 to advise county government on the needs, interests, and issues of older residents and to advocate on their behalf at the local, state, and national levels. Joining me is Mrs. Barbara Selter, Chair of the Commission on Aging, who leads us in identifying significant issues where our voice on the needs of seniors can make a difference. Welcome, Barbara.
Thank you so much, Katie, and thank you for having me today.
Absolutely. Barbara, can you tell us a little bit about the Commission and its mission?
The Commission advocates for the Executive County Council and the Department of Health and Human Services, including the Area Agency on Aging and Aging and Disability Services, as well as other county departments on the interests, needs, and problems of seniors in the county. We conduct public hearings and review and comment on community policy programs and actions which affect older adults with the intent of assisting maximum coordination and getting responsiveness to older persons. Recognizing that Montgomery County is one of the most diverse communities in the county and that older adults are the fastest growing demographic in the county, the COA advises local government on the needs and interests of older adults, their families, and their caregivers. It interacts with residents, nonprofit partners, and the private sector on issues affecting older adults. It supports policies that address the growing needs for programs and services for older adults at all ages, backgrounds, and ability levels. And it identifies challenges and gaps in services and advocates for public policies to address them. In summary, the COA is working to make Montgomery County, Maryland, a community for a lifetime.
That's amazing. Our last guest, Dr. Patrice McGhee, she talked about the county executive's proposed FY 2020 budget or 2022 budget and its impact on older adults. What are some of the COA's budget and policy priorities?
Katie, the Commission has a number of priorities for fiscal year 22, but our top two priorities include establishing 2 additional social worker positions in HHS, one in adult protective services that protects adults subject to abuse and neglect, and a second in the public guardianship program that protects older adults who are too vulnerable to care for themselves. We're very excited that the county executive has included funding for the adult protective services, and we continue to advocate for the public guardianship position. The second priority is providing legal assistance for older adults who are renting houses in the county to avoid eviction from their homes. Many older adults in the county experience rent burden. They have many expenses for medications and food and rent and other things. And they are really concerned about eviction, especially in this time of COVID. So we are particularly concerned about the homelessness that could result from these evictions. Additional priorities include addressing food insecurity by expanding senior nutrition programs, offering individuals access to meals, nutrition education, and opportunities for socialization at community and senior centers, as well as senior buildings. We also are looking to help with home delivered meals and senior nutrition program at 8 facilities. Another priority is to raise the awareness of adult services in the county. We are working to establish a communications committee as part of the commission, and that committee is working to make seniors more aware of the resources that are already available in the county. Another priority is to strengthen the housing initiative. We are really excited about the fact that the county executive budget includes the highest level of funding for rental assistance ever for the county. That's 89.1 million, including 69.1 million for the Housing Initiative Fund. And finally, maintaining and expanding older adult programs, including the Senior Center, active adult centers, working with other agency departments, hospitals, and other entities to provide a variety of programs. And most importantly, transportation programs, such as the Flex program, which provides on-the-spot, door-to-door scheduling of rides for senior adults, as well as the Flash program, which provides express bus service in major corridors of the county.
Does the commission have any upcoming events?
Katie, I'm really excited to tell you about a public forum, a virtual event that we will be holding on May 18th from 10 to 11:30. The forum, entitled Countering Social Isolation and Loneliness of Older Adults with a Commitment to Action, will feature subject matter experts speaking on best practices, innovations, and programs to reduce social isolation for seniors.
Wow, the commission does an awful deal of great work. You know, Barbara, we've had a great conversation. It's informative, and we want to make sure that we stay connected to the Commission on Aging. How can we stay connected to you?
Well, there's a lot of ways for you to stay connected, Katie. The best way, I think, is to go to our website, which provides a lot of great information for seniors. It provides agenda, meeting minutes, and all of the documents that have been produced by the commission. The full commission public meeting is an open meeting. It's the fourth Thursday of every month, and we really welcome anybody with an interest to attend that meeting. And then, of course, our communications committee and the Public Information Office of the county distributes flyers and press releases so that you can keep track of the commission's activities.
Barbara, I could talk to you for hours, but that concludes our program for today, but we'll hope you come back and join us soon. Thank you to everyone who was able to tune in, and for those who will rewatch the program at another time. To learn more about services for seniors in Montgomery County, please visit the Montgomery County Seniors website by visiting montgomerycountymd.gov/senior or call the Senior Resource Line at 240-777-3000.
Our fight against coronavirus isn't over. Let's wear face masks in public, stay 6 feet or more from others, follow state and local guidelines, and wash our hands frequently. Let's move forward together. Learn more at coronavirus.gov.